Today we're going to deal about stress urinary incontinence. So what is stress urinary incontinence? Whenever a woman coughs, sneezes, laughs, exercises or lifts heavy weights, the pelvic floor relaxes and there is no support or decreased support to the lower part of the bladder or the urethra, and the woman involuntarily leaks urine during these activities. This is because of a sudden pressure buildup within the tummy cavity, which puts an extra strain on the pelvic floor muscles, and because they are inherently lax or due to further injury due to childbirth and so on and so forth, relaxes and the urethra loses the support and an involuntary escape of urine happens. This is called stress urinary incontinence. It is definitely much more common in women compared to men. So what predisposes women to this particular problem? Repetitive childbirth, especially through the normal vaginal route. If the baby was very big, or the woman has had a prolonged labor or an instrumental delivery, this causes stretching and tearing of the pelvic floor muscle, which offers support to the lower part of the bladder and the urethra. And because of this, on further aging, the woman loses the support in that area, and that causes laxity and the woman leaks urine. Further insult added by the hormone deficiency due to menopause, especially if the menopause is early in life or induced by surgical removal of the uterus, especially before the age of 40, that can cause further laxity of the pelvic floor muscle. Being overweight or subjected to repetitive lifting of weights because of their job or their profession, and also if they are diabetic and which is not well controlled, this can lead on to pelvic floor laxity and stress urinary incontinence. Do all women suffer from this? Probably more so in the middle age group, especially after the age of 35. This can be common and can be aggravated when they reach the menopause. So it's much more a common problem in the middle age and the elderly. So how do we prevent it? Or is there any way to avoid this particular problem in women? Yes, we do have measures whereby we can reduce the incidence of this particular problem, or should it happen, unfortunately, we can prevent it worsening. The first important thing or advice to these women is try and lose weight, try to reduce at least 5 kilos, which offers a super added benefit to the reduction of leakage and incontinence. Optimizing the blood sugar control is another measure which you can adopt lifestyle change to prevent further stress incontinence. Control of their asthma, avoiding chronic constipation, avoiding lifting heavy weights, and putting further insult on the pelvic floor is something which they should practice so that further worsening of the incontinence is prevented. Also, mainly they should start doing the pelvic floor exercises, or what we call Kegels exercises, which not only strengthen the tone of the muscles but also helps them contract the pelvic floor muscle better, so the integrity of the support to the urethra is maintained and further leakage is prevented. Should all the conservative measures fail, we do have treatment in the form of a minimally invasive surgical procedure for the stress urinary incontinence. Traditionally, people used to have open procedures which lasted longer, which were subjected to postoperative infection and complications, mainly retention of urine within the bladder. Nowadays, we have a single keyhole surgery measures whereby we insert a tape either with the native tissue in the patient or by putting a synthetic tape under the mid portion of the urethra, which acts like a support and a hammock to the pelvic floor muscles. When there is extra strain on the abdominal cavity, the further strengthening by the hammock prevents any further leakage. This can be done as a day case procedure, and women go home on the same day without subjecting themselves to postoperative complications such as wound infection or need of a catheter. Having said that, the success of this is bettered if the woman loses weight or, as a lifestyle measure, avoids lifting heavy weights even after the surgery is done. So what is the success rate with this particular surgery? It's quoted to be anywhere between 80 to 90%. To put it in perspective, if I operated on 10 women with this particular tape, 8 to 9 would get better and they will not leak 80 to 90% of the time when they cough, sneeze, or laugh. Violent cough can precipitate some leakage in women even as a normal phenomenon, and that is why Kegel's exercises preemptively have to be done when the woman coughs, sneezes, or laughs. Control of asthma is paramount before we embark on the surgical procedure, and continue to have better inhalers and avoid triggers of the asthmatic problem should they reap the full benefit of this particular surgery. Women who cannot undergo surgery or who want temporary relief can be given a particular tablet to be taken once daily in the night time. But beware that this particular tablet is not a permanent cure, it's only a temporary measure, buying time for patients to get ready before the surgery. This tablet does have its own adverse effects, mainly in the form of drowsiness and reduced alertness. So, I would advise such women to avoid driving, or which will involve a lot of attention span, so they do not commit errors and not put themselves and others into danger. So, we have covered almost all aspects of stress urinary incontinence, mainly what is stress urinary incontinence, how does it occur, whom does it affect, how to prevent it, and how to treat it. Hopefully, you've had a better understanding about such a common problem in women which affects their life physically, psychologically, and socially. Thank you.